In this video, I'm going to show you how to discharge a patient in Epic. This is all going to be done in the practice environment, so there's no patient identifiable information. And keep in mind that some of this will vary from institution to institution. Now, just getting started, there's going to be three main steps to discharging a patient. Number one is you're going to have to do their med rec or their med reconciliation, where you're going to have to determine what meds the patient is going to go home with. Secondly, you're going to do the discharge instructions, which is going to be basically a summary in layman's terms to the patient that they're going to receive, and they're going to be able to read about their hospital stay and next steps for them as they move forward. And step three is going to be the discharge summary, which is an outline and basic overview of everything that was done in the hospital for the patient. And this is going to be geared more towards other providers and the primary care doctor. So let's just go into a patient chart right here and say this patient is ready for discharge. So the first things that I'm going to do is I'm going to go to the Navigators tab, and we're going to start with step number one, which is going to be the med reconciliation. So after we go to the Navigators tab, we're going to open Discharge, and then we're going to go to this med reconciliation area and hit orders. Once you go to the orders, you're going to review orders for discharge, and you'll notice that all of the patient's home medications are going to be here on the left side, whereas any inpatient medications that they've been taking while they've been in the hospital are going to be on the right side. And what you need to do is really just determine, is this a medication you want the patient to continue? Are you going to change it or modify it before they go? Or are you going to want them to stop this after discharge? So in my previous video on admitting a patient, we had a patient with heart failure exacerbation and pneumonia. So let's just decide what medications this patient's going to go home with. Say they've been in the hospital for 3 days, they've clinically improved a lot, they've diuresed very well. So what do we want them to go home with, okay? Let's say instead of this benazepril hydrochlorothiazide, we actually switch them to lisinopril. So if you want to stop this old medication, you simply hit the X right here, and then you go in the top right and order lisinopril. And you are going to order basically whatever dose they're on, so let's say 20 milligrams. And generally, the common amount of medications that you're going to give a patient is going to be a 30-day prescription with 0 refills. The reason that you do this is because you really want them to follow up very quickly with their primary care doctor in order to get future refills. Accept that, and then go ahead and make sure you choose a pharmacy here. Down in the bottom right. So for our case, we have this hospital pharmacy that the patient is going to be picking up their medications from. But also you could put in whatever CVS or Rite Aid or whatever pharmacy the patient goes outpatient if you want to do that as well. So let's take off this bismuth. We can continue the omeprazole and some of their inhalers. No more need for Bactrim. And then this patient was on warfarin, so we can continue that. And let's take off all of these medications because we don't want the patient to go home with any of this. And let's say we started the patient on metoprolol. So we're going to add the metoprolol that the patient was on as well, and make sure to change that to 30 days with 0 refills as well. So after that, you are going to hit sign, and that's basically it for the medrec. Pretty simple. Now, sometimes there's going to be some other things you're going to want to order for the patient in the discharge tab as well. For example, let's say you want to follow up their creatinine or their lab work in 3 to 5 days. This is something you can easily order here as well. So for example, this patient started a new ACE inhibitor, so let's check their creatinine again in 3 to 5 days. So you just put in BMP, and then you can put it as expected in 1 week, and then we can put this all in here as well. And just because they're getting labs, we might as well just throw on a CBC as well, just to see if that's doing okay in a week as well. And this will be very useful information for the primary care doctor to follow up on. You may also want to put in referrals for the patient. So for example, let's do a cardiology referral, for example. So cardiology referral, and we can put this here. And you're just going to schedule this information here, and they're going to get scheduled for a follow-up appointment. You just have to give some brief information here. So patient recently hospitalized for heart failure exacerbation, continue heart failure management with cardiology. And most current assessment was, whatever today's date was. Another common thing that you may be ordering is going to be home health for patients. So home health is going to be this really kind of convoluted process that you're going to become very familiar with over time. But really what you had to do is you had to do a home health referral and certification, as well as a home health face-to-face certification. And this is all based on Medicare kind of guidelines. And your case manager is really going to help you out with this. But for example, let's do the home health referral and certification. Let's say this patient was seen by physical therapy. They're going to need some physical therapy. And, if somebody had some IV antibiotics or something, they may need home, skilled nursing, but most commonly they're going to need some home health physical therapy. And for the clinic contact name and phone, usually I'm just going to find their primary care doctor. So we could just copy this here and add in the clinic contact name here, as well as down there. And then we're going to also get the phone number. And this is just going to make sure that this is all the information from home health is going to be sent over to this primary care doctor. And you can say, 4 weeks of therapy based on whatever physical therapy says. Sometimes I even put to be determined by the therapist if I'm not totally sure. And let's say patient had physical deconditioning. This patient did have CHF, so we're going to do some home health orders here as well. After you do the home health referral, you're also going to have to do the home health face-to-face certification, which is also you just kind of saying you assess this patient on this specific date, and the encounter with the patient was in whole or in part for heart failure exacerbation and physical deconditioning, whatever you really think is, the reason for their home health care. Patient needs assistance for all activities, moderate level of assistance with use of a walker, and patient will require physical therapy for assessment of functional status, patient caregiver education, instructions and transfer and gait, DME assessment, home exercise. You can really pick all of these because all of these are going to be beneficial for this patient. And also you can do DME orders here as well. So if you type DME, then you can go to Discharge DME. And let's say the patient needs a walker on discharge. So you can get them a 4-wheel walker or front wheel walker, depending on what PT recommends. And you can give them it for however long is needed. Finally, there is also this discharge order set that you can do as well. And this kind of just auto-populates their discharge instructions for the patient. And so this can be a little bit useful. But when you go through this discharge order set, then you can put in, a lot of common things that they may need, but you're also going to fill out any complications during the admission, discharge disposition, discharge diet. So if you want the patient to be on a cardiac diet, and if you want them to be on a fluid restriction, for example, 2 liters a day fluid restriction, these are all things that you can put here. Step number 2 is to write the discharge instructions for the patient. So this is where you're going to go to this patient instructions area and find this DCP patient note. And remember that this note is going to be going to the patient, so you really want to make it in layman's terms so that's very easy for them to understand. So for discharge instructions, you're just going to click right here and say you have some kind of dot phrase. So in my case, DCI is going to bring up my hospital discharge instructions for the patient. And you'll say, you were taken care of on the general medicine team. You were admitted from 9/16 to 9/19 because of shortness of breath and cough. You were found to have too much fluid in your body as well as pneumonia. You were treated with diuretics, aka water pills, and antibiotics and improved quickly. How to take care of yourself after discharge? Please start lisinopril 20 milligrams daily. Start metoprolol 100 milligrams. Succinate 100 milligrams daily. Please stop benazepril hydrochlorothiazide. Follow up with your primary care doctor in 1 to 2 weeks. Please get repeat blood work done at any UC Davis lab in 5 days. And then we have this section here, when to call for help. Please seek emergent medical help by going to your nearest ER or calling 911 if you notice any of the following: fever greater than 100.4, chest pain, shortness of breath, or abdominal pain. Or you could say here for heart failure, so worsening, leg swelling, weight gain, whatever you want to put here for the patient to return to the hospital for if you're worried about them. If you would like to, you can also add clinical references here for the patient. So you can hit this clinical references, and let's say you want to add some information about heart failure. Then you can have some information about heart failure here, and then just add this in here as well. Another thing that you may want to do, depending on your institution, is go to this follow-up tab right here and just open that up. And you can say follow up with PCP. And you can say they can either call, make an appointment, or go to. So let's say they already had an appointment scheduled, so they'll go to this appointment in 1 week. And then you can also do follow up in this department, which is going to be the emergency department. And then you can just say go to the emergency department as needed or if symptoms worsen, and you just accept that. And so this is all going to be information that prints out for the patient as well. Now, finally, you can actually look and see what the after hospitalization summary is going to look like for the patient. So if you go up to this print AHS section up here, then we're going to take a look at what the patient is really going to see on discharge. And so you see here that the patient's name is up here, and it says your medications have changed. Start taking lisinopril and metoprolol. Stop taking benazepril, Pepto-Bismol, and Bactrim. And then next steps, please pick up these medications from the pharmacy. Read this attachment, the heart failure attachment. Discharge activity, no restrictions. Discharge diet, cardiac, restrict 2 liters per day. And then other instructions. So we got the discharge DME here with the 4-wheel walker. We've got these labs that we ordered for about a week from now. And we also referred to cardiology and home health. And then what's next? Please go to the emergency room if symptoms worsen and go to the primary care doctor in 1 week. Now down here, we're going to have a more granular look at their medication list. So it's going to show you which new medications are going to be starting. And then you can also have the mark, is this medication going to be a morning medication or a bedtime medication or anything like that. Finally, you're going to come down here. It's going to have some more information about the new medications, their last vitals, and then also the patient instructions that you just wrote for them. So you were taken care of on the general medicine team. And this is basically everything that we wrote earlier for the patient to read. Lastly, at the very end, you're going to have the attached pamphlet that you gave to the patient. So for this example, we have heart failure, and this is just going to be a lot of information for the patient to go home with as well. All right, so that all looks good. So the next step after that is I just go to the regular orders tab, and once the patient is all ready to go, I'm just going to type in discharge patient. And the patient is going to discharge today, let's say in the afternoon, to home. There's many different options that you can pick here. This patient is going to go home, and we're also going to hit discontinue IV because the nurses are going to need this in order to remove all the IVs from the patient before they leave. And we'll sign that. And after all of that, your patient is pretty much ready to go. The last thing that you're going to need to do is step 3, which is to write the discharge summary for the patient. And again, this is going to be for other future physicians and the primary care doctor to read after this hospital stay. And so this is going to be more geared towards the medical team in the future. So we're going to hit new note right here. And this generally you want to complete this within 24 hours of the patient's discharge. The sooner the better. And so we are going to type discharge summary, and you're going to put your attending up here and use whatever dot phrase that you have. So I have discharge summary, and this is going to load up my discharge summary. So patient was admitted from 9/16 to 9/19, 2021, admitted to the general medicine service. And the discharge service was also general medicine. And we can say patient was admitted for heart failure exacerbation and community acquired pneumonia, was diuresed 20 pounds with IV Lasix down to dry weight of 220 pounds and treated with ceftriaxone and azithromycin. Lisinopril and metoprolol were started on discharge. And then here you can add anything that the PCP should really follow up on. So please follow up BMP in 3 to 5 days. Please ensure cardiology follow-up. Discharge diagnosis is going to be acute on chronic, decompensated systolic heart failure, and community-acquired pneumonia. And you can put whatever other diagnoses that the patient has here as well. You'll see here there's a medication list that's going to automatically generate. Procedures performed, we had none here. And then finally, for reason for admission and brief HPI, a lot of times the quickest way and the most time-saving way that a lot of people will do is really just say per 9/16 HNP, and then you just kind of copy and paste whatever it was. And so this obviously is not accurate for this patient, but you can put this here. The other way you can do it is just do a brief summary in your own words, but you'll see that there's kind of a big style to just kind of copy paste because it's a little bit quicker and a little easier. And then you go to their last progress note for the hospital course. And unfortunately, there's no good one here available, but usually you would go to their assessment and plan and just kind of, paste it right here, and then just make sure it's all updated so that it reflects what actually the plan is. So in this case, the assessment and plan would probably have been like acute on chronic heart failure exacerbation. There would be some details about what happened in the hospital, and then you would have community acquired pneumonia, status post, 3 days, ceftriaxone, and azithromycin. Complete 2 additional days of cephalexin, which I did not order yet in the discharge orders. So basically, this will just tell the primary care doctor what happened in the hospital and then what the plan is moving forward. Physical exam, you're obviously going to just put the physical exam for the patient here, and then micro, and then imaging, just update all of that. And then also all that condition at discharge, the discharge disposition, and discharge diet. These are all going to automatically pull in here as well because you did that discharge order set earlier. And again, all of the recommended follow-up appointments are also going to show up here as well. This is basically all you need to do in order to fill out the discharge summary. All right, so let's just sign that, and you are all done with the discharge. That's pretty much it. So remember, number 1, do the med rec, and there's a bunch of different things that you can do in there as well, including future lab follow-up, referrals, and DME orders. And then go into the discharge instructions, make sure you attach whatever handouts that you want to, and make sure you keep this in layman's terms. And then finally, go into the discharge summary. The one last thing that I wanted to talk about is if you are doing a discharge to a skilled nursing facility, there are a few steps that are going to be different. So for a skilled nursing facility discharge, you are going to have to do the med rec, as well as a SNF orders note and a discharge summary before the patient actually leaves to the skilled nursing facility. So you need to have all of the paperwork done before the patient leaves. So in terms of the SNF orders, there's actually going to be a SNF orders or a SNF discharge note that you paste here. And so this is going to pull up a note that you just need to fill out in order for the skilled nursing facility to kind of know what to do once they receive the patient. So primary diagnosis, CHF exacerbation, community-acquired pneumonia. Rehab potential is going to be fair, and code status, we'll just talk about hospice, and then SNF, we are going to say the patient does have capacity. The diet is going to be fluid restricted, 2 liters a day. Activity is as tolerated. Vital signs routine per SNF. SNF weight, let's do patient has a diagnosis of CHF, please weigh daily. PPD done, no. And there was no PPD done, but yes, there was a chest x-ray done on the day of admission. They all need this for, screening for TB before they admit patients to the SNF. Wound care, none. Bowel care, routine per SNF. Foley, no. And then no other things that we want them to do. There's no dialysis, but these are all things that you were going to fill out in case you need the patient to follow up with some of these things like dialysis needs or labs or anything like that. So you can do BMP and CBC in 5 days. Please forward results to PCP. All right, and so we are going to sign this. So this is going to be the SNF discharge note. And then we're going to sign the discharge summary. And so let me just get rid of these asterisks, and then we can just sign this. Obviously, you would have filled out the physical exam and stuff there. So all of this paperwork is now ready for the patient. And then one more little caveat is that when you do send patients to a SNF, you are actually going to mark their new medications as historical medications. You're actually not going to prescribe medications to your pharmacy because the SNF is going to have their own personal pharmacy. So what you actually do is you're going to go to review orders for discharge, and let's take a look at some of these new medications that we ordered. And instead of ordering this to our personal pharmacy, we're just going to put this as a historical order. This is going to add this medication to the patient's medication list, but it's going to be filled at the skilled nursing facility. So just make sure you go through and change all of the medications to historical. And that way, everything will work out properly. And then we can sign the medications here. So that's how you do a SNF discharge. That's how you do a regular discharge. Please let me know down in the comments below if you have any questions or if you want any further clarification about certain aspects of discharging. This is definitely a complicated process that's going to take multiple repetitions until you really get into the flow of it. And even then, there's still so many more things to learn about how to do a smooth and efficient discharge for your patient. But hopefully this video helped. Thanks again for watching. I hope to see you in the next video, and peace.